In this video, I'll be discussing the societal impacts of dissociative disorders. All of the statistics that I talk about here are located on the website as well. Dissociative disorders are highly prevalent mental health disorders which are found in about 10% of the general population. Individuals who suffer from them will often utilize the healthcare system to a great degree, but never receive a diagnosis. Failure to properly diagnose and treat dissociative disorders has a very high human cost. By the time many dissociated patients are correctly diagnosed, they are demoralized and have suffered substantial secondary losses from years of unproductive treatments, hospitalizations, suicide attempts, disfiguring self-harm, disability, and careers as chronic treatment-resistant patients. Dissociative disorders constitute a hidden and neglected public health problem. Better and early recognition of dissociative disorders would increase awareness about childhood traumata in the community and support prevention of them alongside their clinical consequences. They are very often linked to early life stress in the form of childhood abuse and neglect. Better recognition of these disorders would be of historical value for all of humanity, including global awareness about and prevention of adverse childhood experiences and their lifelong clinical consequences. Diagnosis and treatment of dissociative disorders is a major public health issue. Patients represent a large, underserved population whose lack of recognition leads to substantial human and societal costs. Males with dissociative disorders may go particularly unrecognized, despite the fact that these disorders affect the genders equally. Prospective treatment outcome studies of severely ill dissociated patients show significant improvement in symptoms, including suicidal and self-destructive behaviors, with reductions in treatment cost. A major public health effort is needed to raise awareness about dissociation, including educational efforts in all mental health training programs and increased funding for research. Women have traditionally been thought to be impacted by dissociative disorders to a higher degree than men, but empirical studies have indicated that dissociative disorders do not differ between genders. The seemingly dominance of dissociative disorders in women may also depend on the sociocultural context, because men with dissociative disorders usually do not enter the general health system, but rather the legal system. That is to say that they can be found in jail or forensic institutions. DPDR tends to be long-lasting. Depersonalized patients often experience significant impairments, utilizing mental health care to a high degree, which nevertheless might not meet their treatment needs, as patients strongly opt for obtaining disorder-specific counseling. Childhood sexual abuse, physical neglect, and emotional abuse were significant predictors of a dissociative disorder. Dissociative disorders are commonly overlooked in studies of suicidality, but in the population within the study linked on the site, they were the strongest predictor of multiple suicide attempt or status. In one study, depersonalized patients were younger, more often male, had a longer disease duration and an earlier age of onset, and a higher education, but were more often unemployed. They tended to show more severe functional impairment. They had higher rates of previous or current mental health care utilization, and nearly all patients desired symptom-specific counseling. These patients had lower levels of self-rated traumatic childhood experiences and current psychosocial stressors. However, they did report a family history of anxiety disorders more often. African and Asian American individuals reported significantly higher rates of dissociation compared to white individuals, and comparatively their higher rates of dissociation were associated with lower rates of psychological distress. Dissociation also predicts violence in a wide range of populations, and may be crucial to an understanding of violent behavior. Depersonalization was most related to aggressive behaviors, as there is underactivity within regions of our brain that are important for regulating anger and other emotions. Individuals who recognize changes in their behavior and ability to maintain these emotions may be unable or less able to control it as the disorder progresses. The results of this study suggest that adolescents who have high dissociative tendencies are inclined to show aggression towards others more directly. Again, failure to properly diagnose and treat dissociative disorders has a very high human cost. By the time many dissociated patients are correctly diagnosed, they are demoralized and have suffered substantial secondary losses from years of unproductive treatment, hospitalizations, suicide attempts, disfiguring self-harm, disability, and careers as chronic treatment-resistant patients. Earlier recognition, diagnosis, and treatment of dissociative disorders show much better outcomes in terms of patient health. The answers on the site are a start, but more work needs to be done to treat these disorders. 10% is too much to have so few studies. It's too much to have so few answers or treatment options. It's too much to be unable to receive an accurate diagnosis. Raising awareness about disorders like this can be critical in breaking cycles of violence and aggression, bringing more stability into the lives of children with difficult home environments, and bettering the mental and physical health of hundreds of millions of people. Hey everyone, thanks for watching that video. You can find more information on the project's website, otbproject.com. All the information discussed in these videos is thoroughly researched and sourced on the site. As always, please make sure to like, comment, and subscribe, as these types of disorders have very negative impacts on the individuals and the people around them, and educating yourself or sharing this information could make all the difference in the world for you or a loved one.